On today's episode, we got my buddy Austin Andrade. He's a professional strongman out of the Mighty Heavy Metal Fitness in San Antonio, Texas. We also have on with him Dr. Justin Reyna. Dr. Justin Reyna is a chiropractor out of San Antonio, Texas with the Modern Movement. We talk about rehabilitation and soft tissue care.
You're listening to the Gabe Molina Podcast.
The modern chiropractor is really well equipped to become a natural medicine primary care physician. And so we wear two hats. We have a mechanical hat where we look at soft tissue, musculoskeletal injuries, where we adjust people, we do corrective exercise, and we're really concerned on the physical adaptability of the patient. Then there's the second hand, which is our biochemistry hand. That's where we're looking at, well, how is the internal chemistry and how is that affecting the way that you're showing up and performing in your day-to-day life? And sometimes there's carryover between how's your biochemistry affecting your musculoskeletal pain and how's your musculoskeletal pain affecting your biochemistry. And so I think that you're really leaving so much meat on the bone if you don't look at both of the pieces of the puzzle.
Okay.
How about that?
Yeah.
Boom.
I'm going to have to Google a lot of this.
Right. Hey, that's why I'm here, bro. That's
Thank you.
He's my translator.
Even though I don't know what the fuck he's saying.
Let me see.
You watch Key and Peele, Barack Obama's translator?
Oh, the black guy?
Yeah. So Barack Obama says it nice and the translator kind of screams it. That'll be you.
No, bro. The whole reason I wanted to do this podcast is because this dude's opened up a whole new light to performance in sport. For me, at least. And then I could see it like how it could just be day-to-day life.
Like, and Austin knows this because every time we do a podcast, I bring it up. But like, even for me, like I've got this shoulder and lower back issue.
You got the whole thing, bro.
Well, I went to go see. There's a whole lot going on, but I went to go see fucking Ryan, and so it was funny because he goes, "Hey, lay on the table and let's see where you're at." And so, dude, I laid on the table,
Funny story.
and I spasmed from my neck to the middle of my back, lower back.
Just laying on it?
Just trying to lay flat. And like it just was spasming, and he's like, wow. And so I didn't even finish laying down. I was I was on my elbows. And he's like, can you lay flat? And I said, yeah, let me try fucking. And so I started putting my elbows out, and spasm hit. And so I ended up just pushing up, getting up off the fucking table so I could stand up and bend over. And I looked at him, I said, that's where I'm at. And he goes, yeah. And
yeah, I could hear that. Hear him saying that.
But like, and this is bad because like, probably about 2 years ago, no, fucking longer. Man, maybe like 12 years ago.
Oh, that's a big difference.
I remember.
There's still a 2 in it.
There's 2 in there. I remember getting out. I put my leg out of the truck, and I got this sharp pain across my lower back, and I couldn't move my feet. I couldn't move my legs, anything. Luckily, I was still sitting in the truck. So I pushed myself back in. I sat down. I called a buddy, and we worked together for a long time. And I said, hey, man, I don't know what's going on, but I can't move my legs. And he's like, what happened? I said, I put my left leg out, and I felt a sharp pain across my lower back, and I don't know. And so I sat there for maybe 5 or 10 minutes, went away, and I'm Mexican, right? So, I'm cured, you know? And so forget about it, right? But when I think back, I think it goes all the way back to that time where it was like, I think that's the first time I remember having a back issue. And so
It's like you're driving and you're like the check engine light and you're just like,
you put your finger over it, or you take a Sharpie, right? You color over it. So I remember ever since then, and so several years ago, man, there was a time period that like I couldn't get up off the sofa because that lower back would spasm. And I remember my nephew come in and he'd help me up, stuff like that. This is the time of year I cough for like 3 months. So fast forward to about a couple years ago.
this is the 2-year part. No.
Yeah, this is where the 2 kicks in. I had my ears messed up. But I would lay there in bed, and I would literally wake up to my back spasming. And so it got to the point, and Ryan talked about it a little bit, like needing to get sleep. But it got to the point where I'd say 2 years ago, I was taking Dad to some appointments too. I had gotten down to about 2 hours or an hour and a half of sleep a night because it would spasm, it would do all that stuff. And then I came across 2 Tylenol and 4
Ibuprofen.
There you go. And man, I take that. Now, that's not a great thing to do. But typically, if I don't do that, I can't sleep at night.
You do that every day?
Every night.
Ooh.
So I don't. I only do. So I do it once, but it's usually every night. Every now and then I'll risk it, and I'll be like, nah, I'm not gonna take it tonight because it's a lot of pills, right? And so when I get up to pee or whatever in the middle of the night, it's brutal. Like it's gotten to the point where I won't sleep anywhere but at my house. Like I'll go out of town, and last weekend I had to do something Saturday and Sunday in Georgia West, which is about an hour and a half away. Mm-hmm. And my sister has 4 bedrooms, and she's like, stay at the house. I'm like, no. She's like, why not? I said, because getting up out of bed is terrible. There's a lot of screaming and yelling and motherfuckering, and so it's gotten to that point. Now I will say this: a while back, I was being more consistent with kettlebells, and
this is patient 0 right here.
Oh, dude, no, it's like patient negative 1,000.
This is the
like you and
The
Brian
origination.
would have. Yeah, that's where it started. So the kettlebells thing had been helping because I would literally just hold it out in front of me and engage my core and just stand there. And I would count to 5. I started off counting to 5. And after a while, I'm counting to 50. And I noticed I was sleeping a little bit better. But also the just getting sleep is I noticed, like, if I get 6 hours of sleep where I don't have to get up and I don't have to go to the restroom or nothing like that, physically getting up feels better. But anyway, I think this podcast started on me rambling on my issues.
I think so too.
Bro. All right, so first of all, 2 years ago, I started with Ryan. Me and Ryan met at the sauna at Evolve, and he's like, hey, I'll sponsor you, I'll work on you.
Let me pull you that a little closer.
I'll sponsor you, I'll work on you. And I was like, okay, cool. Like, I don't know. I didn't really know what massage therapy was going to do for me. I was like, you're going to just like make me feel relaxed, whatever. But he's like sports massage, so he takes that approach to it. Mm-hmm. And he made it so where I could make it through like my first rookie year of World's Strongest Man, able to perform. But just like piecing me together for these shows, like just getting me to where I could go and perform decent and do well at these shows. And then by the end of the year, I was like, damn, this is, this is almost worse than when I was. But mine was just, it was almost like an 45-hour session before each workout. So I could go work out, and then we'd have this whole regimen before a show, so I could go to a show and perform at the show. And then the next week I was in shambles again. And but I was really almost abusing Ryan, like just him working on me all the time.
Yeah.
And he does great. And now with what I call him Justin, his name's Dr. Reyna, but he's just Justin to me.
What do you want me to call you? Because
I think Dr. Reyna's good if we're going to post it for social media.
Yeah, Dr. Reyna. All right, well, this is gonna be weird. No, but and then like meeting Justin and seeing what he could do, and I'll tell you how it was crazy how he diagnosed me just by looking at me. But on top of that, and then like Ryan's work has gotten so much easier when he works on me, so where tuning me up for a show is easy now for him, where I don't even need Ryan's work sometimes during the week unless like, all right, it's a heavy day, or let's just tune you up a little bit. Let's get something a little bit more activated or whatever. But to a point, I don't have to like rely on him so I can work out again. But that's when you reached out to me about Strongman coaching.
Yeah.
So he was like, hey, I want to get into Strongman. And he just hit me up on Instagram, and I was like, yeah, let's get to it. And I didn't, honest to God, I didn't even realize he was like a full-on doctor and shit like that.
Oh, right.
I just, you know what I mean? Well, that goes into my
Well,
ignorance.
most doctors aren't that thick. You know what I'm saying?
Well, this is the other thing. Well, this is just my ignorance, bro, because I didn't know like the whole. I mean, I knew you worked in the medical field, but I didn't know what the extent of any of it. It's the same thing with the whole massage thing. Like I didn't know what the hell like sports massage was going to do for me.
You're like me. We stay oblivious to some things. We pay attention, but like you don't necessarily go. You hear somebody can help you with something, but you don't think, okay, well, let me pry into your background and your history kind of thing. So we just kind of roll with it kind of thing.
You know, and the first time I ever met Justin, Dr. Reyna, was at Ill with the Steel.
That was 2 years prior to when I reached out to you. Yeah,
a powerlifting meet at Heavy Metal, and this dude showed me it was a week after I told
your super sprinters. Yeah, we did.
I sprained something in my shoulder, and I was trying to bench like more than 500 pounds, and well, mind you, I don't ever bench. We don't ever. It's
400 pounds is a lot of weight.
Well, we only do overhead press and strongman.
Thanks.
We only do overhead and press and strongman, and so we rarely hit bench. And this is a lot different movement. Mm-hmm. You're using a lot more. Well, anyways, this is like one day that I can bench, and I'm not going to affect anything in my workout. So anyways, I was like, let me see if I can bench 500 pounds. And so I
of course, that's where you want to start.
Like, yeah. Let me just try.
I bench 500 pounds, and
a quarter ton.
They're like, that's easy. You should go up. Well, sure enough, they throw 525 on, and I get it right here, and I feel something in my shoulder just go.
I think I remember you saying that.
Oh, it was the worst pain. Well, so he brought his company as like a vendor at that powerlifting meet, and Michelle was like, hey, he has a sonogram machine.
A diagnostic ultrasound.
And it's portable?
It is, yeah.
Okay.
He was looking
I even have a cooler one now attached to my phone.
Oh,
really?
Right, yeah. He was looking at my shoulder. He said, yeah, you sprained some shit in your shoulder. But that was the first time. And then you told me to come to your place.
Yeah.
And they're having a little festival, and I got popped, and that was like the first time.
Don't say I got popped because it makes you sound like you had drugs on you.
Oh, yeah, I got cracked.
Well,
I don't know if that sounds the same.
You strained something.
Synonyms.
But I think that was like the second time I ever got cracked ever by a chiropractor. The first time was after I popped a rib out doing something at the gym.
I remember you telling me that.
And then this dude, I went to the joint, and he just put my rib back. And that was the first time I ever got cracked by a chiropractor. And then, well, I don't even really like to call them chiropractors now after knowing what you do. But this guy just put my rib back into place. And then the second time I got cracked by
Dr. Wilkinson.
Dr. Wilkinson's there, and I felt great afterwards. And then I don't know. I didn't really follow up with anything there. I just, whatever time went on. And then you reached out to me for strongman coaching, and said, yeah, we'll go. And he was going to some gym not too far from Heavy Metal, but it didn't have
the right equipment at all.
You know what we have at the gym.
Oh, so
it's
well, y'all redone a whole bunch over there.
Yeah.
You have all kinds of new stuff over there.
Well, yeah, on top of that, but just the strongman stuff alone. And I told him, because I was sending him programs, and we're working out, and I'm like, man, if you really want the full effect, you really need to like come to Heavy Metal. And so he came to Heavy Metal, and I started showing him around the gym, like, look, we can use this for this, or your deadlift week here, we'd use this. So he started coming, and then one day we're doing a front squat workout, or we're both squatting or something like that, and he like looked at me and was like, hey, do you have pain in your right knee? And I was like, what the fuck are you talking about, bro? Like, not once have I...
You were like, not till you said that.
Well, no. Honestly, I've never... The only person I've ever told anything about pain is Tim and Ryan and Nick, right? And he's like, yeah, when you squat, you shift on your hip or something. I'm sure you got pain in your knee. And I was like, what the fuck are you talking about? Dude, it just fucking blew my mind. And so he's like, I do dry needling. You should come and let me work on you. And I was like, what the hell are you talking about? So me just being like the, ignorant kind of person, whatever, I went to Ryan and I was like, hey, what is...
Let's just refer to you as a handsome powerhouse.
Okay, that one, handsome powerhouse,
that
I am.
Yeah.
I went to Ryan and I was like, dude, what is this? Like, what is dry needling? Like, he's like, bro, it's great. You should do it like this. And I said, well, this dude Justin's like telling me like he does this, and I'm totally not, skeptical to it, whatever. And I told you, I was like, hey, it's not that I don't trust you or anything. I have full trust in Ryan because, what.
Sure.
And I said, Ryan went to go check him out, and he came back, and Ryan's like, yeah, this dude's legit. Like, you need to check him. You need to go do it. I was like, all right, fuck it. I got Ryan's okay. This dude I trust fully with all my recovery
Well,
stuff.
your body is not my body in the sense that I get up and I go sit at a desk for 12 hours. You have to perform, and you have to. Your body is your moneymaker, so to speak, right? That's how you perform, and you go after competitions and things like that. So it's different.
Well, everyone's an athlete, but not everybody trains.
Man, that's a whole snap right
How
there.
do you feel about that? You start training now?
I'm cutting that whole portion out. I look like a jackass.
I don't like that.
Bro, but all right, so I go to his clinic again. I've been there before, and I just went to one of the rooms the first time, and you know how you like, especially Tim, how he vets people, and you like ask people certain things to see what their answers are going to be, and just to kind of see if they understand like the whole lifting lifestyle, and so like I was throwing everything at Justin over here, Dr. Reyna, about it, and he was hitting me back with all this stuff, and I was like, okay, this dude knows what he's talking about, right? And then I went to his clinic, and then he took me to another room, and I went to another room. He's got tables, and then he has a whole ass gym.
I've been watching your Instagram, and it's funny because I watch your Instagram and I try and figure out what's going on, and I'm like, this is more complicated than what it looks like. There's a lot going on at your gym.
Bro, that's what I'm saying. So like, I mean, how many times you go to a chiropractor or chiropractor quote unquote, and they're like, oh, you need to stop doing this. Your back hurts, stop doing this. This hurts, stop doing that. Right? How many times so I was like, my knees. So we'll get into the dry needling thing, but he needles shit on my hips, and he's like, all right, how's that feel? Walk around. I'm like, damn, I got no more pain in my knee. Like, it just feels so much better. And he's like, all right, go deadlift over there.
Is this with the needles still in?
No.
Okay.
They're out there.
You've already pulled them out. Gotcha.
But so I mean, like right after, he's like, all right, go deadlift. You know what I mean? And not, we gotta hold off on that stuff. And it's like, well, we need to go see how it feels now. We need to go test it, see what more you need.
And that's where the gym comes in.
It is, and really, I think what people need to understand, or what I want them to understand, is life and movement is not about restricting yourself. The more pain you live in and the more you restrict yourself, the smaller your world gets. And as your world gets smaller and smaller and smaller, then you decay. The whole point is to promote resilience in people. So maybe we have to modify a movement, but you never, ever stop moving. As soon as you stop doing something, it becomes progressively more difficult to get back into it. Think about weeks and months that maybe you stopped exercising. Well, guess what? Your low back pain is still there.
Are you looking in my soul right now?
That's the other part of why I have this fucking podcast, because I knew exactly what this was going to do to you.
I feel like Austin has told you about me for a year now.
I set this up, bro.
Yeah, right. This is an intervention.
Everybody's fixing to come out the back. It's like, oh, great, Nina's here.
Gabe, we need to talk. And so, let's go down that road. You stop doing the thing because your back hurts. Well, now 6 months down the road, you're weaker and your back still hurts. Well, now you need to do two things. You need to get stronger and get yourself out of pain, which is more difficult now. There's also been a chronic component to the pain. There's a fear to movement that can develop, a frailty, if you will, if somebody continues to tell you to not do something. And then if people happen to pop, 2 Tylenol and 4 ibuprofen.
That's a good little.
Yeah. Is that your cocktail? Yeah. Your cocktail? So, well, check this out. Every single dose of an NSAID, right? That's your Aleve, your ibuprofen. There's a 2 millimeter bleed in your stomach every single time you take one.
Okay. So my stomach's literally bleeding.
Literally bleeding, dude. Every single time you take one ibuprofen.
Let me tell you something. They're pretty decent right now, but I've had some really dark shits.
Yeah, that's called melena. And so whenever there's an upper...
Don't laugh. This is medical, Austin.
Yeah. Whenever there's an upper gastrointestinal bleed, right, your stomach, your small intestine, that blood has a lot of time to oxidize, so it becomes dark. So you're pooping out blood.
What's the medical way I should have said that?
It's called melena.
Melena? Mm-hmm. And melena is that dark blood?
It is, yes.
Yeah. So yeah.
And so over time, one of a really common side effect of taking right of taking NSAIDs is you develop a gastrointestinal ulcer, right? So you develop an ulcer.
Let me ask you this: is that because something that I've also noticed recently is like, man, I'm answering my own question before I even fucking ask it.
There we go.
But
therapy.
Like I get this. I've got especially the last, I'd say last month, like always nauseous. Like everything. Like I have this constant kind of like not really stomach ache, just nauseous, and everything makes me feel. Whether I'm eating like shit or if it's just like straight deer meat or something that I've smoked or whatever. Like everything makes my stomach uncomfortable now, regardless of maybe it's
Could be
bloody poops.
Yeah. Well, right.
Just took it right
Hey,
there.
only one of us here is a doctor, so
Inflammation of the stomach, stomach lining, right, from taking the NSAIDs over a long period of time, coupled with the Tylenol. Tylenol depletes you of your most crucial antioxidant in your liver called glutathione. You've probably heard of glutathione. It's kind of a big deal in the longevity medicine, functional medicine space. And so what antioxidants do is they reduce inflammation, right? And what's funny is you're taking a drug because you have inflammatory pain. So, and this is the irony of a lot of medicine, is it treats the symptom, but it makes you less resilient at combating what you're trying to treat on your own.
oh,
Right? And these NSAIDs, right, for pain that you're taking, they actually make you more inflamed, and they promote degeneration in your body. So something that you may see with somebody that takes a lot of NSAIDs is they develop osteoarthritis quickly. They develop chondromalacia patella quickly, which
What's
is
that?
so the back of your kneecap. So you have your knee. The back of it has a cartilage on it, and that cartilage protects your kneecap from compressing against your femur. As that starts to degenerate, people have pain and swelling on their kneecap. That's chondromalacia patella, and there's different
and then
grades.
they pop more Tylenol.
Boom!
So it's a slippery slope.
It sure is.
You start.
Snowballing down the mountain.
That's interesting
Yeah.
because I think a lot of times a lot of us attribute it to, hey, I'm getting older, or hey, this is arthritis, or maybe something's genetic, whether it's rheumatoid arthritis or something, and very few people especially in the Mexican community will go, oh, my dad had rheumatoid arthritis, I do too, and it's like, well, have you gone to the doctor? No. But Dad had it,
Self-diagnosed.
Yeah.
Right, and so it's just kind of one of those things where it's like, well, let me take these.
It's tradition.
Yeah, it's a family heirloom. Right?
I'm 40. It's about that time for the kicker. Yeah.
So, yeah, and it's funny because everything you're describing is Gabe to a T. So,
Yeah, well, and to your defense, it's 99% of people, and I think that comes down to a medical system that doesn't require people to take accountability or to have to actually step in for a role in their own health, right? So an example is, well, it's just genetic. Is it genetic, or is it a lifetime of accumulated poor lifestyle decisions that have
and
finally
usually
caught
that's
up to
what
you?
it is. Yeah,
Right.
That's usually what it is. You sit there, and it's funny because I'm 48 now, and so I'm entering this new era where I go. I can look back and I've got some data, right? And it's like, okay, well, you start to prioritize. And it's funny because when I first was talking to whether it was Austin or whether it was Tim, and to hear somebody, a gym owner, say, hey, you need to invest in your health, right? And it's like, okay, you're going to pay X amount of dollars to come see me ever so often, and we're going to work out together. And it's funny because, like, to a lot of us, and I say us, we see that as a luxury spend, right? And I gotta pay the car payment, I gotta pay insurance in the house, which means I gotta work and I gotta do all those things. But we don't invest in the health portion of our lives, right? We just go, okay, well, if I have extra money, I'll do these things.
Yeah, it takes a back seat.
It takes a back seat. And so we start to, time goes on, it's like, okay, when I was 18, I could do this. When I was blah, 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 I could do this. And we kind of, like I said a minute ago, we kind of attribute that to, hey, I'm getting older, or this is a genetic family heirloom, right? And it's kind of like, well, that's not necessarily the case, right?
This is your grandmother's.
Yeah.
This is your grandfather.
I've been waiting for this.
And so, we kind of like look at our physical fitness and just movement in general. And I've been fat my whole life. People have told me, hey, you got to keep moving. And in my mind, I go, man, I need to keep moving. And then all of a sudden it's like, oh, you got a deadline in the morning. You got to work till midnight, right? And you're already not sleeping because your back's giving spasms in the middle of the night. And so before you know it, you're working 10, 12, 13 hours a day, and you still got to do X, Y, and Z, and you still got 2.5 hours of sleep, and you've fallen asleep on the way home from work, and it turns into this whole friggin' mess. Yeah. And it's almost like, I've slowly started to watch what I eat, exercise more, walking more. Even just standing watching TV, right? I have I've said forever, I have a very sedentary job. I sit in the truck to go to work. I get to work. I sit at work. I sit in the truck to come home. To me, just standing to watch TV is kind of like, okay, well, at least we're not fucking sitting, because all of a sudden I sat down 21 hours in a day. And it's like, that's way too much. So just being conscious of that kind of stuff. But then I find myself going, okay, I get back into those comfort ruts, right? Where it's kind of like, my back really hurts. Let me sit and stretch a little bit. You stretch a little bit and it's like, okay, things are real tight. And you start getting comfortable. And this is that like a slow death, right? Where you get comfortable because the thing that you're doing, you're not having that immediate pain when you're doing the things you should be doing, right? And so you go, okay, well, I'm gonna do this a little bit longer, right? I'm gonna maybe lay in bed a little bit longer, or I'm gonna take a few more ibuprofen, or I'm gonna do X, Y, and Z. And it's this snowball, this decline that people, all of a sudden you wake up and you're 60 and you're like, what the fuck did I do? How did I get here? Yeah. And it's like, oh, it was slow. It was a slow death, man. And you ignored the signs and you didn't do those things. So I think it's important for folks to realize, it's funny that you just said everybody's an athlete. Not everybody works out, because I think a lot of times when you get out of competitive sports in school or just anything like that, you're like, okay, I'm not that person anymore. And it's like, well, not necessarily. You can still do some things, whether it's go for a walk or, stand and fucking watch TV, or, I've got so much shit at my house. And it's like, it's all in the living room. And if I don't leave it in the living room, I don't pick it up.
Because you won't see it. Yeah.
I won't see it. I've got resistance bands hanging off of a column there at the house, and I've got a little sled.
He's also got one of the best gyms to ever go to.
Heavy Metal Fitness, yeah.
Have you ever heard of that place?
You know what's funny is like...
Hey, your nephew owns it, right?
You know what's funny is I sit there and go, I'll drive home from work, and I'm like, dude, how in the fuck are you fat when Tim owns a gym, your father-in-law is a dietitian, your sister-in-law is probably, she's got I think a degree in... the same thing Tim does.
Kinesiology.
Kinesiology. And I'm like, how the fuck are you fat? Apologize, doctor. I shouldn't talk like that in front of doctors.
In front of smart people. Bro, it's crazy because like when I was telling you, Ryan he was busting his ass just to keep my knee together. It felt like keep my knee together for these shows. And then I go there and he's like, yeah, your hip's messed up. And he's like, yeah, we're going to stick a needle in your hip. I didn't get into his dry needling thing, bro.
What is? Let's hang on. Let's pause on that real quick.
Greatest thing in the world.
I guess one thing I want to understand a little bit better is I'm sure there's some overlap, but between the work that Ryan does and the work you do, where's that overlap and what is the difference? Because in my mind,
that's a great question.
In my mind, I'm like, okay, Ryan's, and not everything's exact, right? But in my mind, okay, Ryan's working on muscle, you're working on bone structure. Am I way off, or is it kind of in the ballpark?
I actually really like that question, because I think people associate chiropractors with bones.
Right.
Crack bones. But it's really not that, right? So kind of like we talked about, I don't know if we got it at the beginning of the podcast, but chiropractors wear two hats, or they should. Right, there's the mechanical hat, which is the movement, the musculoskeletal system, which includes nerves, connective tissue, ligaments, tendons, and muscles. Okay, we're in charge of all that. That's, a piece of cake. But there's also the biochemistry lens. And so I think to get a full picture and understanding, you have to know what's happening and what the target tissue and the site of pain, as well as the pain generator is. So Ryan, he's an amazing massage therapist, very skilled at what he does. His major focus is going to be tissue management, right? Because he's performing what's called a passive treatment. You're laying there and he's applying a therapy to you. So he is managing the tissue tone, as well as some of the inflammatory responses that tissues have whenever they're irritated. Now, what I do is I'm more about movement. So what is the breakdown in movement, and what's the pain generator, and whatever that is, I'm going to go after it. Okay, so it can be anything in the body. It could be he's not eating. Oh, for example, Austin here has a hiatal hernia, right? And that's where his stomach has herniated into his esophagus.
Oh,
very common.
That sounds uncomfortable.
It's really common.
Yeah, what he does to me is uncomfortable.
How do you?
Oh, he'll get into it.
Yeah.
Okay.
So for example, Austin has pain that occurs sometimes in his lower left rib cage. So what I did is I looked at how he was moving, and I found that at some point he likely tore his rectus abdominis, which is an abdominal wall muscle. But
not the rectum, dude. Rectus.
I was gonna say that's what it was. I saw
his face. I saw his face.
In my brain, I was like,
the gleam in his eye, right? Try not to laugh.
I know how he tore it. Nick.
Right. and so as I was examining the tissue, I noticed that his stomach was inflamed. It was irritated. So what I did is I applied pressure, and I mobilized that area, and his pain went away. So in that particular scenario, the tissue I was involved in was actually an organ, right? So.
And do you is this through touch? Are you able to like feel the muscle structure and kind of where his organs are?
Yeah,
and
exactly.
You can tell just through. Okay.
Yeah.
You know what's fucking nuts, dude? Is you feel it move.
Really?
Yeah. Oh yeah. And it gurgles and everything.
He did it Thursday, yesterday.
Yesterday.
Yeah, he did it yesterday, and I felt it move.
Yeah, and the stomach gurgles and everything. But it's not just from touch. I think another good point is, I would say like 85% of chiropractic school is medical education. We spend very little time, still more than anybody else, but little time, relatively speaking, on chiropractic adjusting. Most of what we take is anatomy, physiology, pharmacology, toxicology, physiology, really heavy neuroscience. We spend over a year dissecting cadavers every single day of school. And so we apply our medical diagnosis and our ability to find out exactly what the problem is, whether it's musculoskeletal or it's internal diagnosis. Does this person have cardiovascular disease that's driving their pain, right? Then we come up with a treatment plan. And so I think it's really important to understand that chiropractors really are way more than bones. Now, however, there are many chiropractors that only adjust bones, and they pay very little attention to being a good doctor. But when I went to school, and the school that I went to, it was way more emphasized, and the modern chiropractor's education is way more emphasized on being a good doctor.
I was going to ask, is this a new philosophy that chiropractors practice, or has this always been part of the industry, I guess?
So since the early 1900s, there's been a big schism in the chiropractic philosophy, if you will. So D.D. Palmer delivered the first adjustment in 1895. That's the guy that started chiropractic. And throughout his time period, he was persecuted a lot because he was making claims that chiropractic adjustments could treat blindness and deafness and stuff like that. Because according to him, his first adjustment cured the hearing of his somebody that would clean his office. And so in order to avoid persecution, he very specifically labeled that chiropractors do not, they treat dis-ease. That's different than the word disease,
Okay.
right? Because whenever he'd go to court and they say, well, you're treating diseases with these claims that are not true. I'm not treating diseases. I'm treating dis-ease, right? Okay. But his philosophy,
smart.
Yeah, right. He had to because he kept going to jail.
Yeah.
Right. And so, because of that, though, what drew people to chiropractic initially wasn't that chiropractic adjusting was treating all these different conditions, but it was the philosophy of natural health. And that's why chiropractic is the largest natural health care organization or group in the entire world. And the idea there is that we promote resilience and optimizing health. One of our treatments is spinal manipulation, but it's like a cake. You don't make a cake with eggs, right? The cake is the optimized healthy human. The eggs are part of the cake. The spinal adjustment's part of the treatment.
That, huh?
Oh yeah. I just got a little water in my mouth too. I lie.
So all that to say, what we do, or what the schism was, is that those people, they wanted to practice what's called straight chiropractic, which is only spinal manipulation. And then there's mixers, if you will, which are people that introduce full continuity of care, which is the use of, I do a lot of blood work on patients, stool analysis. I just diagnosed a patient with Klebsiella overgrowth of bacteria in their gut.
What is that?
That's a pathogenic bacteria. It's most commonly acquired in the hospital. And so this bacteria, it's a chronic infection in your gut. And that chronic infection affects the way that you absorb nutrients as well as the way that you respond to pain. And so this patient was seeing me because she had reoccurring back pain. Now, what I thought was really interesting about the low back pain is I could not reproduce it with a mechanical test. So when that happens, you start to get a little suspicious and you say, if I can't reproduce it and I'm putting you in all these different compromising positions, is this pain a mechanical pain? Maybe not. So let's look internal. And so we found this bacterial overgrowth. Now we've treated.
Was that through blood work?
It was through a comprehensive stool analysis.
Okay.
And we did blood work on her as well, and we've been clearing things up there too. And so since we started treating that bacteria, she hasn't had back pain.
Really?
Yeah. So if I was just the standard rack 'em and crack 'em chiropractor, if you will, and if they want to do that, that's fine. I'm really a big proponent that people could and should practice the way they want to. I would have continued adjusting that patient and taking their money, and they would not have gotten better.
All right.
But because we looked deeper, we found the root cause of her back pain and likely other disease processes that were starting.
That's interesting. It's funny because, and I get it, right? You have to have a specialty.
Yes.
But I'll give you my dad, for example. I mean, he had all kinds of issues. He was sick. But he saw all these individual doctors, and it was interesting to see how little they overlapped, how little I think at one point he was in the hospital because 3 different doctors had given him blood pressure medication, and his blood pressure was super low. But for me, to hear you talk about how you kind of, and maybe this is a lack of a better term, but the crossover that you do, you have the specialty, but you focus on that, but you also utilize all these other things because our bodies we're not a car, right? We're not even cars. If you let something go bad for long enough, it's going to affect something else.
Yeah.
But in the human body, I think it happens a lot quicker and it's more drastic.
Yeah.
Everything is interconnected, whether it's your bone structure, or whether it's your muscle structure, or it's how your organs are operating, or some sort of bacteria in the gut. And I think a lot of times, people get frustrated with the medical industry because there's that, hey, I do this and I didn't check anything else, and you've come here for a year and you still got the same problem, but we're still giving you 2 Tylenol and 4 Motrin, right?
Yeah.
It's a good cocktail, right?
So,
Yeah, they're so highly specialized which is extremely useful in critical care scenarios.
Right.
If you're going in, you want the best of the best.
Right.
And this guy only does this. That's why he's really, really good at it. But in the wellness, the health, and longevity space, that doesn't work because we do not exist in a vacuum.
Right.
And another kind of issue is like you were saying, if you have a disease, like let's say cardiovascular disease, well, that affects multiple systems.
Sure.
But you go to these specialists and they're not going to interrelate these things.
And why is that? Is it just because they're hyper-focused on whatever organ or whatever thing that they're, or are there doctors out there that say, you know what, hey, I mean, I get it, right? If you come in and I'm a heart doctor and I check you and your heart's fine, but you're still having issues, I will say, hey, well, you need to go check out so-and-so and have them run some tests. But it sounds like, and you're not a heart doctor. You're not sitting there to go, hey, this is exactly what you have, but you're checking all these things, right? You're looking for markers that kind of indicate what could be the issue. Yeah. And I think that's, like I said, I think that's where people get frustrated, is because they'll go to, let's say somebody comes to you, they're having some sort of ailment or pain or something. And so you run these tests, you do everything, and you figure out what route you need to put them on, as opposed to like when somebody goes, hey, I'm feeling this, and you go to your primary, and it takes you a month or two to get in there, and then you get in there and you get seen, and he says, okay, well, you need to go get a MRI. And now I got to go get a fucking MRI, and you go down this long road, and it takes forever to get you to where you need to be, and the whole time people are still living in pain, or they have some other issues, or whether it's medical issues or discomfort. It's just I feel like a lot of times people get so frustrated with the medical industry because it's either a long route to get to where they can feel better, or their doctors aren't communicating as well as you would like them to. So it sounds great that you cover all these bases and you have all this stuff in house, especially like the equipment you talked about when you were checking his shoulder, or the weightlifting stuff that you do in house. I think it sounds amazing. Anyway, I just kind of took off on a tangent.
Yeah.
Yeah.
Should I go back on this dry needling thing?
Oh, yeah.
Dude, it's...
So is that the long needles?
Yeah, so good question. I'm a history buff, so I'll give you a little bit of the history of dry needling.
Love history, too.
Oh, me too, right? It's like you understand thinking if you listen or look into history. So acupuncture, one of the oldest forms of medicine, right? Kind of interesting, different approach than dry needling. They manipulate energy and chi in the body. Anatomy doesn't matter to an acupuncturist when it comes to pain. So they may have put a needle in his big toe for his low back, right? Because his chi is off there. I'm butchering that. I'm sure there's acupuncturists that are going to be upset, but that's kind of a layman's version of it, right? John F. Kennedy, he had something called Addison's disease, and that causes an electrolyte imbalance in the body. Well, what happens when your electrolytes are off? You cramp.
Yeah.
Now imagine them permanently being off forever. You're probably in a lot of pain. People used to say John F. Kennedy had a bad back, right? He was known for being in pain. So the White House physician at the time had to figure out, how do I manage JFK's pain without putting him on narcotics, because he's the president of the United States. So she started studying alternative treatments, and so she came across acupuncture. And she said, okay, this is interesting, but it doesn't make sense. So they started manipulating it and modernizing it and putting an orthopedic approach behind it. And they came up with something called dry needling. So where dry needling varies from acupuncture is it's very centered. It's centered upon anatomy, muscle, skeletons, nerves, discs, spine, how the body's moving. And so because of that, we use varying lengths of needles. So
to touch different parts of your body.
So how deep are we going?
So like in Austin, I use a 165 millimeter needle in his glute to get to the bone.
Dog, it's crazy.
Does it hurt?
No.
No?
You feel a little poke. It's a needle, right? It's a very thin needle. And then it gets to the deep target tissue. And sometimes that can feel like an ache. Like you've had somebody dig into like a trigger point or whatever. It's like that, but deep inside.
Bro. Yes.
I've done a podcast with Dr. D with Reaction Sports, and she talked about dry needling. And I thought, no way in hell.
Dude, I was the same way. All right. Well, just talk like he was talking about, remember I was telling you he saw my hip was jacked up? Mm-hmm. Well, how many muscles do you have in your hip?
3?
A shit ton.
Okay.
Bunch.
A whole, and they're all running different areas. They're all doing this, right? So your leg, I didn't know what the hell internal rotation was, but that's like your leg turns this way. You should, like, your hip should be mobile in all those ways.
Yeah.
Mine was not.
Yeah. You're like me. Our hips move because we bend our knees.
I couldn't bend my knees. So at me, it was just bending at the low back. But with massage, sometimes you're not going to be able to reach that deep of a muscle. You can't get into that. And so with the dry needle, you can hit that muscle. You just got to go through a little couple.
So what is the needle doing when it hits the muscle? Like scientifically, so to speak, right? Yeah. Is it actually tearing muscle tissue, or what is it doing once it gets in a? Because I've seen where they hook up like jumper cables and stuff to it. So are you okay? So you're getting the needle into that muscle tissue, and then you're introducing electricity to it to make it spasm?
Yeah. So what I do is I put a needle in. A lot of the times they're going into a trigger point. And so a trigger point is dysfunctional tissue. It's contracted. It shouldn't be contracted. Most typically it happens whenever there's an unstable environment. Where there's too much movement, it's not stabilized in the joint. The brain's really smart. It wants homeostasis. It wants protection. It cranks things down.
Oh.
That's how you get tight.
Right?
Oh.
So that's the neurologic piece to it.
He's so smart.
I'm telling you, bro, he's a doctor.
And handsome.
Oh. What are you doing afterwards?
Breaking down a podcast.
So the biochemistry piece of that is you have to understand that there's something called a resting membrane potential. So
write that down.
He's writing it down in a minute.
So our tissues, they stay at a certain negative millivoltage.
Okay.
Right? And so they're chilling. This is at rest. Now, whenever there is a movement that needs to take place, we get just a really tiny bump in that millivoltage, and that causes the cell to open up. So sodium can move itself into the cell, and sodium is a polar, it has a positive charge. So it goes into the cell, and it takes that negative resting membrane potential, and it skyrockets. It goes up really high so that we can move. So what happens biochemistry-wise with a trigger point is calcium, which is a negative molecule, attaches itself inside of the cell. So that resting membrane potential gets even lower. So it's harder for that tissue to contract effectively. So when you put the needle in, you basically remove that calcium ion, and then something called adenosine, which is a neurotransmitter, attaches itself. And so you're changing the biochemistry of that particular tissue. Then you twist the needle up.
Oh, that's gacho, dude.
Like bad gacho or good gacho?
No, like God, bad. Like, hey, bro, when he's got the 13 in, he's playing fucking DJ on your
Yeah, I do, because I like. One thing about me is I like to have a lot of pot stirring at the same time. So I like to do this, walk over here. I'll be needling multiple people at the same time and holding different conversations and stuff. That's just kind of how my brain likes to work, like an octopus.
Right.
And so when I twist that needle, you can imagine scar tissue or damaged tissue is kind of like this. It's not uniform. So that needle in here, it's like a spaghetti fork.
Okay.
So those tissues are now realigning. And so mechanically now they can move better and transfer force better. Because when a tissue is scarred, let's say there's an insult or some type of moment, which is movement in biomechanics, it goes this way. Well, we want that to enter and exit effectively. But if there's a disrupted road, you're going to hit a speed bump. And every single time you contract that muscle, it continues to beat up and beat up and beat up that same spot that's already damaged. So you want to realign those tissues. So that's number 2. Number 3, what it does, putting the needle in releases something called endogenous opioids. We have the ability to create our own opioids, right? And there's these things called opioid receptors. So you basically...
So the body naturally can make...
Opioids,
okay.
Correct. So, the body's incredible whenever you really look into what it's capable of. And so those opioids come into play, and then something called beta enkephalins, which reduce inflammation. All of this also changes something called central sensitization. So many times, whenever there's not even an injury there anymore, we've already healed from it, we still have pain because our brain has created a sensitization. It's oversensitized that area. It doesn't realize that it's healed. So you change that feedback loop as well. And then lastly, whenever you attach the electrical stimulation on, that creates a mechanical pumping effect. And that can change fluid. So if there's edema in the tissues, you can move that out. You can bring in new nutrients. And that basically...
This is all through needling?
All through needling. Yeah, it's a long conversation every time somebody asks me what it is.
I didn't realize it was that complicated.
Yeah.
It's not complicated. It's fucking beautiful.
It's beautiful, yeah.
And so...
Well, it's beautiful that the body reacts to an electrical impulse or that needle.
It does, yeah, exactly.
I mean, the body's doing a lot. And something that's, I'm not going to say it's simple, but it sounds simple. I mean, the act of is simple, right?
Correct.
But the body's reaction to it sounds super complex.
It can be, right? And understanding that allows you to know when to apply the right treatment to the right area, right? And so one of my mentors said, a good doctor knows how to help somebody. A great doctor knows why. You need to know why you're doing every single thing you do.
Blowing minds.
I'm telling you, bro.
It's interesting because I'm probably gonna need to be a patient.
I'm telling you,
Oh,
bro.
it's funny because like we're talking when you're talking about the needling and what it's doing. So patient zero, right?
I'm telling you.
Years ago, I was told about that I had carpal tunnel. All right, I sit at a desk, I type a lot, I use a mouse, and I don't always, ergonomically, I'm probably worst case scenario. But
Is that meme I sent you?
Yeah.
Mike Wazowski?
Yeah. The database is not where it's supposed to be.
There's a meme out there. I had to send it to you, bro. But you seen that Mike Wazowski?
Yeah.
And then it says, "This is what your patient looks like, and this is what the book." And it's like this perfect body. And this is what the book textbook that you saw your whole entire.
You know what? I haven't seen that.
Yeah.
Well, it's funny because not funny, but it's funny.
It's funny.
Where I have carpal tunnel, right? And just recently, I've noticed grabbing my wallet, grabbing a cup, grabbing things. I get like this sharp electrical impulse, and I drop things all the time. Like I've dropped mugs, I've dropped my keys, I dropped my wallet, and it's just there's a while back, and I'm kind of screwed up because I like to sit there and watch it too. But I grabbed something off the top of the truck, and I was pinching it, I think with these two fingers, and I was watching my hand just do this thing, and it was so painful from like here to the tips of my fingers. It was like electricity, and I was watching it, and I couldn't barely hold on to it anymore. Finally, I had to put it down, you stretch my hands out or whatever, and take a minute, and I was able to grab it again. But I noticed here lately, there's this weird thing that's happening where I'm grabbing simple things or doing simple things, and I'm getting these like lightning pains in the palms of my hands or my fingertips. And I'm like, I probably should talk to somebody.
Yeah. It could be a lot of different things, right? Bilateral carpal tunnel is fairly uncommon. So I start thinking about, well, where is that supply of nerve coming from?
What's bilateral?
That's both hands,
Oh, yeah, I got them both.
right? Because
Hey, bro, you're rare, dog.
Yeah, I feel. What was that movie with Rodney Dangerfield where he says, "I'm gonna donate my body to science fiction"? That's how I feel right now talking to you guys.
Dude. That guy's so funny. Every once in a while, I'll pop on YouTube and I'll watch some of his old skits. It's classic,
It's classic.
So carpal tunnel, right? That's compression of the carpals, which are the bones in your wrist, that they create this compression on the median nerve. And that median nerve starts in the neck, comes through the brachial plexus, makes its way down the arm, through the pronator teres, which is a common entrapment site where it gets compressed as well. And then it goes through the carpal tunnel and it supplies nerve supply into the palmar aspect or the under part of the hand.
Is that why they told me before? She said, the doctor that diagnosed me with this, she said if you don't take care of it, it'll work its way up your shoulder and your elbow and all that good stuff. That's why.
Yeah, well, there's a phenomenon that's called double crush, and so double crush is if there is a distal or a further away compression of a nerve, a proximal compression also takes place, right? Because you don't realize it, but you are micro changing your movements. Okay, pain is the last thing to show up and the first thing to leave. So if you're already in pain, there's been compensation and change to your movement patterns way before you realized it. Okay,
Bro, that's how it was with my squats. And
Really?
Just
So you were adjusting because you were in pain already, and that those minor adjustments. I mean, our body's made to do
and it changed
a lot of things.
it changed the way I squat, changed the way I pressed, it changed the way I was deadlifting. I was still doing the movements, but very inoperable or
inefficient. Yeah.
Inefficiently.
Yeah, well, you know, when I met Austin or when I first worked on him, I said, dude, how did you get so far in this sport without using your body? You know, because he's just probably, he has to be the strongest person on planet Earth.
Yeah.
Truly, seriously, I believe that. Because he got so far into strongman without any resources, really, right? Like he's operating, let's say, on 70%. He's using 70% movement efficiency. Now I think he's closer to 100%. And we were joking the other day, you know, because we worked this whole off season together. He's like, dude, I feel kind of weird going into the Arnold not being in pain. I wonder if I pushed myself hard enough.
That's a real thing,
Yeah.
because there's times where it's like even me just physically feeling better.
Yeah.
Right. There's times where I'll give you a great example, and this is a terrible fat guy story, but like I told you earlier, I don't care. I talk about everything. The other day, I like to park on the top of the parking garage at work. And the other day, it was so cold. Elevator broke, right? So I was like, man, my fat ass is going upstairs. And it was funny because I got up the stairs, and I have this little heart monitor, right? And my heart rate was elevated, but it wasn't what I thought it was going to be. And I remember going, the fuck's wrong with me? You know? So it's weird to go, I don't feel terrible.
No.
Something's wrong. And it's like, well, hang on.
That's what I'm saying. Like when I tell you Ryan was piecing me together to go to these shows, like he was busting his ass. So I just felt good enough to compete. To now, it's like I would like, and then I was like, we're talking about it. I can't say I didn't push myself hard enough, because every single workout I did, I was hitting a new PR. Mm-hmm. I was pushing more weight I never pushed before. It was like I would get done with the workout and just everything was elevated. The numbers were showing that I'm doing better. Mm-hmm. But I'm like, in my head, I'm like, damn, did I push myself? Because I don't feel like shit right now.
Yeah.
I don't feel like at the end of prep, I'm like, oh God, like I don't know how I'm gonna, as long as I get a week of rest, I'll be good. And so it's nuts, dude. Like,
what does that make you feel like when because it's almost as if you know the tools, you know the process, you know the input and the outputs. What does that make you feel like when you see somebody confused because they feel good? You know what I'm saying?
Yeah.
Because that's what it is, right? It's like he's confused because he's like, well, maybe I didn't do what I could have done because I don't feel miserable. You know, and it's like, for somebody like you that understands the input and the output, you know, to see that, what goes through your mind?
Well, I think, like, wow, this person, first of all, I think this person's resilient as heck, because they've probably always equated pain with preparedness for a sports event.
Hey, no pain, no gain. Come on,
That's what they say, right?
Yeah. Truly, right? So I think this person's ability to tolerate pain is extremely high, which is part of why he's as strong as he is, because getting really strong and lifting heavy weights it's uncomfortable.
Yeah.
Right?
I don't know why I do it.
He just does it for fun. But
he does it for more room for more tattoos is what he's doing. He's adding on to that skin.
You gotta get more bicep to. But then I also think, like, there's just so much meat left on the bone for this athlete, and he's barely scratching the iceberg on his performance potential.
Yeah.
So it makes me very optimistic.
Well, and I also see, follow you on Instagram, and also see you've got a wide range of athletes.
I do.
I mean, they really run the gamut from all types of sports and just I think different competitive activities. But what is your approach is the same for all these folks? I mean, I guess them coming in and them visiting with you, you've got to go through this process, and you talked about the blood work and kind of evaluating them. What are some of the other things you're seeing in other people that are not, bench pressing 550 for fun?
Yeah.
Is it a lot of joint movements, or is it like I think there was an MMA fighter or something that fought recently
she
too.
did. She won. That's Liv Beerley.
And what is kind of the things you see in I guess people who fight competitively? What are some of the things that I guess is it broad? Is it individual? Or is it kind of like, hey, I see this constantly in a ballerina. I see this constantly in a fighter. I see this constantly in a strongman. What are some of the things you see in some of these other competitors?
That's a good question. So I think I heard something one time. It said people that excel at whatever they do have one similar common trait, and that's they're really good at pattern recognition. If you can recognize patterns, you can become extremely efficient and get better and better and better. So I always have a certain pattern recognition in different types of athletes, and I gather that from the history. But it's not always just the athlete that they are today, but the athlete they were in the past, right? So for example, if Austin was a ballerina for 15 years before he got into strongman, that may clue me in to look into certain different areas that take a beating during ballerina sport. So with fighters, for example, I need to know what martial art they train in primarily. So did you ever play Street Fighter?
I did.
What's the name of the guy that used to say Tiger? Anyways, he fights Muay Thai.
I just knew there was a blonde guy and a dark-haired guy.
Yeah, Ken and Ryu.
And a monster.
Yeah.
And then a hot chick.
Yeah. Chun-Li, Blanca, right? Perfect. So there's this guy, I used to play Street Fighter a lot growing up, and I always used to look at this guy. I'm like, man, he stands so weird. And he would stand with his hips tucked under him like this and his hands forward. Well, come to find out, that's the Muay Thai fighting stance, right? You're always kind of here, hip forward, because you have to be able to kick a certain way at a certain speed, right? Muay Thai is known for their kicks. And so because I know that this particular fighter primarily fights in a Muay Thai stance, I need to look at their pelvic mechanisms, I need to look at their hip flexors, I need to look at their lumbar spine, their low back, as well as their thoracic spine. Because there's a principle in biomechanics that's called regional interdependence. So to put that simply, there are joints that are designed to be mobile, and there's joints that are designed to be stable. And those are predicated upon the range of motion that they have in either one plane or three planes of motion. One plane, vertical upright, is the sagittal plane. You have the frontal plane, and then you have the transverse plane, which is between, which is more of a rotational plane. So if a joint can move really well in all three planes, it is designed to be a mobile joint. Think about the ankle, right? You can twist your ankle in a circle, your shoulder can move in a circle, your hips can move in a circle. Your knees primarily move forward and backwards. They do have a little bit of rotation, but they're extremely weak there, right? Lumbar spine's the same way. Moves mostly forward and backwards. There's only like 3 degrees of rotation in the lumbar spine. The thoracic spine, the mid-back, for example, moves a lot. So something that you need to screen, or that I typically screen with a patient, is their side of pain is here. Does the joint complex above and below move the way that it's supposed to, right? And if it doesn't, then I need to either classify them as a stability motor control dysfunction or a mobility dysfunction. Does this person have a mobility problem? If they do, then I'm going to use a mobility intervention. A really good mobility intervention is a spinal manipulation or a soft tissue technique. But if they have a stability motor control dysfunction, do they have difficulty stabilizing? Therefore, they're tight. They're not tight because they're immobile. They're tight because they can't stabilize. And I manipulate that joint, it's actually going to make it more unstable. So I may introduce therapeutic exercise or motor training to that area, right? So again, it's always knowing which hat to put on and which spice to use for the food you're going to cook.
I guess what the true value in people like you is understanding that whole process, right? A fighter doesn't want to, I mean, it's interesting. They want to understand their body and they want to know all this stuff, but it's so complicated, right? And an athlete wants to perform well, right? And it's almost like, that's the value in somebody like you is I want to be top of my game, right? I want to squat, or I want to deadlift, 1,100 pounds. How do I get there? And it's like, it's interesting because I try, and I'm a patterns guy too. I try and go, okay, what is my knowledge base? What can I learn? But it's so much more complex than what anybody understands. And, it's funny because you're sitting here talking about the ins and outs of it, and here's the physical proof that it works, right? And just listening to Austin talk about what you've done and how he feels, that's, you see excitement on his face, right? That's the person who can get out of bed with no pain now, right? That's the person who can go for a long walk with their loved one. And it's like, these are things that your average Joe Blow doesn't understand it. And it might be too complex for some people to understand. But at the same time, the end result is this guy being able to perform, this guy being able to go home and relax and not be in pain, and to be able to compete at a high level, or maybe even higher than what he potentially could. You talked about earlier him being at like 70%. Now he's more at 100. And it's like, for somebody that's chosen a career path to pursue, this is ultimately at some point, Austin's going to be on TV and have his own show, and this is going to be his livelihood. It's like, to be able to, it runs a gambit for folks, right? You got patient zero, and you have top of his game, right? And they all need the same things, right? They all need to be able to move well, function well, and avoid chronic pain, And it's interesting just to hear you talk about these things, because I don't realize, I always like to think that I'm somewhat of a reasonably smart guy, and I even just the needling earlier, like I had on a molecular level, holy shit, there's a lot going on, right? It's creating a new planet, just at the end of that needle, and it's mind blowing, man. I mean, it's exciting too, because you sit there and you go, it's like, okay, so I don't have to be in pain so long. I need to hook up with the right people. I need to go see the right doctor. I need to go see, the right types of people that can get you figured out. Yep. And I think that's where a lot of people fail, is they don't, and so many times in so many of these podcasts that I do with people, and I'm guilty of it too, because you don't know what you don't know, right? You don't know what's available. You don't know. A lot of people sit there and go, well, I'm just old. I'm just always going to be this way, because they don't realize what is available to them, or maybe they just never thought that there were other things that could be done to help them be in less pain and more mobile. So it's exciting, man. It's exciting to hear you talk about it.
It is, man. And I think the best part of my job is to see people have hope again. Yeah. Because as soon as hope is gone, you become a different person. Oh, yeah. I have a patient right now. I'm not influencing his care on this, but he's getting these blood clots in his brain. And he has 25 doctors that he goes to. They don't know what's causing it. And he'll randomly be driving, and he'll go blind in one eye. He'll have to go to the hospital, have to do some stuff, and they don't know what's causing it. And he's at the point where he's starting to lose hope. And because of that, it's starting to put him in a dark place about if he wants to continue doing what he wants to do. Yeah. And all that to say that if you can give hope back to somebody, and you can only do that if you can resonate with them. You have to be able to connect with your patients. There's a saying, there's a Parker principle. So I went to Parker University, and they have these success principles, if you will. One of them is that you need to love every patient like your mother, your brother, your sister, or your dad. You have to connect with them, and you have to have a genuine desire to want to help them and know about their family. And I think the way that doctors used to be, right, where like they're part of the community. They're not just somebody that you go see for 5 minutes and they tell you, take this drug and come back whenever you have another disease. That's not what being a doctor is about. Being a doctor is about integrating yourself into people's life and showing them and teaching them sure, that there is a better way to do things and that they're capable. you have to inspire them too.
You know, it's funny. It's funny you say that because with Dad being sick at the end of his life, it was interesting because my parents are very old school, small town type people.
Sure.
And, you know, one thing I learned from my mother-in-law before she passed was you have to advocate for yourself, right? You have to ask questions. Mm-hmm. You have to, you know, for lack of a better term, demand answers, you know. My parents were more so of this passive, you know.
Doctor said this.
Exactly. Doctor, no, well, the doctor said, and
he didn't say this. So this is not a problem.
Right.
Yep.
And so it's nice to hear somebody say, hey, compassion and not even just compassion, but be able to say, hey, when I give you my time as a doctor, I'm giving you my time, however much of it you need.
Yep.
You know, because I think a lot of people, they have the anxiety and the fear that their body's deteriorating and they're done. You know, and so a lot of times I think people come to terms with that earlier than what they need to. Right?
They do.
They sit there and go, okay, well, I'm just falling apart, and that's just the way it is, and I'm gonna go easy. You know, I'm gonna just let it take me. I'm just gonna fall apart. You know,
my world's gonna get smaller.
It's gonna get smaller, and you know, to be able to have somebody in the medical industry, and I'm sure there's tons of people that'll sit there and go, you know what, no, you know, I care about you. This is gonna work out. You know, a lot of times, even I go back to Dad because Dad was the most recent who was sick, but it's like he'd go to Corpus and he was miserable to go to the doctor in Corpus because if he had to go to the ER, it was 2 weeks every time. And I'd get so frustrated because it was kind of like, okay, Dad got sick, Dad's in the hospital, and so you call Mom and it's like, okay, well, when did they see him? They haven't seen him yet. He's been there 3 days.
8 out. Yeah. Oh wow.
It'd be three days hence he.
Oh, they have him admitted.
Yeah, and it's like okay, so then the doctor comes and sees him, and it's like it's a Friday, and it's like okay, he's gonna have a procedure Tuesday, and then I mean it was so crazy, and maybe it was just kind of I don't know what it was, but you know, all of a sudden it was kind of like, well. No, they didn't do the procedure. The anesthesiologist forgot to show up. Mm-hmm. You know, and here you got this old man in a chair who's, for one, concerned about the procedure he's going to endure.
That's somebody's dad, man.
And then all of a sudden it's like, oh, anesthesiologist forgot to show up. Okay.
Hey, you know what's funny about, you said like community, when, you know, how heavy metal is and the community we have at the gym. Because now, I got him working out there now, right? And then on top of it, I'm pushing his services on everyone, right? Because I just a true believer in it now. So like you got a problem? You need to like. First of all, it's like, can Ryan take care of it? All right, if Ryan can take care of it, you need to go Justin, right? And then now it's to the point you're walking in the gym and like he can't even get to the squat rack before talking to 15 people, bro. But he won't say no. He's not gonna say no. And then you know what I mean? He's like, well, yeah, come on, let's figure it out. It's been awesome.
That's awesome, man. So let me ask you this before we wrap up. Do you have availability to take on more patients?
I do.
And so if somebody wants to I guess, have a consultation with you, kind of, and I'm sure it's like most things where, you know, let's feel each other out. Am I right for you? Or you know, can I benefit you in any way or whatever? How's that process go and how can people reach you?
Yeah, so typically patients will come in for their initial evaluation. They'll spend at least 30 minutes with me and then 30 minutes with my rehab colleagues. And so they'll come in, we'll sit down, we'll have a long history. What brings you into my office today? X, Y, and Z. Okay, let's examine this. Let's do an orthopedic assessment, a movement assessment, if those are the routes that we need to go down, or is this more of an internal diagnosis perspective, in which case we'll order comprehensive labs, which are much more complex and detailed than you'll see through your standard insurance-based care. So patients will come in, we'll figure out what we need to do, and then create a treatment plan from there.
Do you guys accept people's insurances?
We're cash pay.
Okay.
Yeah, and the reason that we do that, I always tell patients, I work for the patient, I don't work for the insurance company.
Right. Okay.
I do not want to be denied because the insurance thinks that they know more about my patient than I do.
Right. Oh, the insurance. You know what's funny is
I love how insurance are like, yeah, you know.
Yeah, I was literally thinking this in the shower this morning. I was thinking about insurance companies, and I was thinking, it's not this drastic, but sometimes it feels this way. It almost doesn't make a difference if you have insurance anymore. Well, they don't really want to cover hardly anything or give you the medication or whatever you need.
I had a patient that got this recent strand of flu, that avian bird flu, tearing everybody up. And so because it's so bad, I said, hey, you should maybe consider, there's a drug that's called Xofluza, which is like the updated Tamiflu. All right, talk to your doctor about it, get it prescribed. So they got the Xofluza. With insurance, it was $100. Without insurance, it was $101.
I tell you what,
hey,
it's
dude,
crazy.
that dude lost his life over insurance. That's
yeah.
No, that's right. It's a freaking nightmare, man. It's funny because I've talked to people recently about like cancer and things of that nature, and it's like it's so frustrating because again, it comes back to hope, and a lot of times it's not even just the hope of, hey, somebody's has cancer and they've got to deal with that. But it's like, what's your insurance going to cover? Well, how much are they not? How much are they going to? I often told my wife when my mother-in-law was alive, my father-in-law was a little bit older than her, but he had done very well for himself. He was smart. He wasn't wasteful. He saved money. But she'd go to MD Anderson every 3 weeks and stay for a week. And it's probably $1,000 to $2,000 every time they went for hotels and, everything else of just being in Houston for a week for that kind of procedure. And, it's kind of like, what does everybody else do who wasn't smart with their money like your dad was?
Mm-hmm.
They go home and they die and maybe go to a couple of treatments and that's it,
Yeah, and they may go through inefficient treatments with a disease that's time is not on your side because this is the little loop you have to do with your insurance. Oh, you got to try this one. Oh, that type of chemo didn't work. Or maybe chemo is not even the right type of treatment for this cancer. Maybe immunotherapy works better, but the chemos may be cheaper, so you go through the chemo. Yeah. So you're really, I think those are very sad scenarios because those are end of life a lot of times.
Yeah.
There's a saying, and we talked about investing in your health, it's a regular person has 1,000 dreams. A sick person only has one.
Yeah.
Right?
Yeah, to get better. Dr. Reyna, where can people find you? Social media and the name of your company, all that good stuff.
Yeah, so we're the Modern Movement Sport and Spine. Currently, we're located off 1205 North Loop, 1604 West, Unit 225 in the Vineyard Shopping Center.
Okay, awesome. And Austin, you're still Smash Andrade?
Yeah, Smash Andrade.
Three competitions coming up this year, right?
Yeah. The Arnold Classic next week, and we got World's Strongest Man, and then Strongest Man on Earth. 3 of the 4 majors of the year, awesome. Which is nuts to think about. Let's go. That a couple years ago I was an amateur, but yeah, we're there.
It's so funny.
We're gonna end this podcast with your adjustment.
Yeah,
I'm gonna perform it on you. Though.
Oh,
I've been teaching
Lord. I'm gonna walk on my back. Let me tell you something. This is funny. When heavy metal was at the first place, Michelle had been working out a whole lot. And I think she was getting ready for a competition. And I said, hey, walk on my back. And so she's like, okay. Which you're probably thinking, what the fuck are you thinking? And so I laid down. Michelle starts. I didn't realize how dense she was. She'd been working out. So she gets on my back, and I'm trying dense. To be,
Yeah, Michelle, you're dense.
No, like physically, she was very muscular. And she got on my back, started walking around. And I had to be the tough guy, and it hurts. A rib ended up popping. And nice. So I ended up going home, and I think I told my wife, I said, I broke a rib. I said, I didn't realize she was so heavy. But no, she's beautiful and sweet, and I love her and hope she sells 1,000 houses.
She's amazing. Yep.
Well, fellas, I appreciate your time.
Yes, sir. Thank you.
We'll have to talk one of these days about your 1,000-pound nap that you took, or the one that went over.
Oh, that's 1,000 pounds. Or
he's got another one coming up.
I didn't take a nap. I didn't pass out during it.
I thought you was so easy you decided to go to sleep.
Yeah.
I slipped.
Oh, is that what it was?
Yeah, because my hips were messed up. Dressing wasn't working on me.
Well,
yet.
Let me ask you. Let me ask you.
1,100 this year.
How did you not friggin' break anything?
It landed at the right spot. Yeah.
Did it?
Because I'm dense.
Because your arms are tied to the bar, so it's not like you're dropping.
I know, because I had it locked out. Because it was a finished rep. And I had it up here.
At his hip, yeah.
if I would have had it down here
Broke
and I
his
would have
fingers.
felt, my knees would have went the other way. It was a locked out rep. I just fell backwards.
I didn't realize there was.
I just put it down the wrong way.
Well, I was.
Yeah.
Well, good luck, man. Good luck this year. Man, we'll follow up again. I definitely, there's a lot of knowledge here that I'm sure we need to circle back again.
Hell
yeah.
And maybe bring some of your colleagues on and anything you want to talk about, because I think there's a lot of chronic pain that people endure and they don't need to. They just need to find the right source and the right place to kind of get them sorted out, and things can get better.
Right. I always tell people when they do an exercise that hurts or a movement that hurts, something's wrong with you. It's just your resilience hasn't caught up with the demand that you're asking for your body yet.
Yeah.
And so if we can just get you better prepared for what you're trying to do, you'll be able to better handle that task.
Yeah. Dr. Reyna, thank you so much. Austin, always a pleasure, brother.
Hell yeah, brother.
Thanks, everybody.
Later.
Thanks for listening to the Gabe Molina Podcast.
Yo, Barry.